Krista Davidson is a speech and language pathologist and clinical professor in the Department of Communication Sciences and Disorders at the University of Iowa. She specializes in the education and supervision of graduate student clinicians in the treatment and evaluation of clients with augmentative and alternative communication needs across their lifespan. Krista is also the inventor of the mobile application Rescue Voice, an AAC app designed for and used by first responders and medical professionals. She enjoys presenting at the local, state, national, and international level on a variety of AAC related topics, as well as clinical supervision. Please welcome Krista.
Thank you. Appreciate the introduction. So we'll go ahead and get started. Just a little bit more about me. As you said, I'm a speech language pathologist. Before I came to Iowa, I worked for 11 years as an AAC and assistive technology specialist at a special education cooperative in Southern Illinois near St. Louis. While I was there, I also did some adjunct teaching, supervision, and consultation. Now I've been at Iowa for 8 years, and I am currently a clinical professor. I lead our clinical AAC team. I teach our AAC graduate course. You can see the pattern developing. I also started an AAC outreach program in our community, mostly geared towards first responders, but we've also talked to our SEATS transportation here in Iowa City. We started that in 2022. I do live in Tiffin, Iowa with my husband, 2 sons, and our adopted pup there. So the agenda for today's webinar, I'm going to go over the basics of augmentative and alternative communication, or AAC as I've been calling it, examples of AAC, some strategies to communicate with someone who uses AAC. We'll talk a little bit about my app Rescue Voice at the end and have time for any questions or discussion that you might have. So maybe you've seen some people on TV using AAC. On the left there we have Steve Gleason. He played football for the New Orleans Saints, but he has ALS. In the middle there is Stephen Hawking, famous physicist who had ALS. He passed away in 2018. And then there on the right is the Lost Voice guy. He's a stand-up comedian, and he won Britain's Got Talent a few years ago. But I'm here so you can help people in real life in your community who use AAC. So with that, let's get started. Now, I did want to say, I know we have a mix of professionals here. So for some of you, this may be review. And for some of you, it may be brand new. And so bear with me for those of you who maybe this is review for, and for those other folks, I hope you can take something away and learn a lot today. So what does AAC mean? Well, the augmentative part means to supplement or add to someone's speech. So they may have maybe not all of their speech is unintelligible, so it's just a supplement, versus alternative means to replace speech. So it's used in place of speech, where they really may have no functional speech, and so they use this instead. And it really means all the communication tools that a person uses. And actually, we all use AAC every day when we wave, text, or even roll our eyes. So again, AAC, this is our American Speech Language Hearing Association definition, is that it includes all the ways we share our ideas and feelings without talking, and that we all use AAC every day. Like I said, it's facial expressions, gestures, sign language, body language, writing with pen and paper, some low-tech systems and high-tech systems, and we'll talk a little bit more about those in a few minutes. So who uses AAC? Individuals who have severe expressive communication disorders. They could have impairments in speech, language, reading, and writing. AAC could be for permanent, forever, or maybe just temporary use. And like I said, it can supplement or replace speech. But there are no prerequisites for AAC except for breathing, as the diagram shows there. So who uses AAC? Again, it could be someone with a congenital disability, something that they were born with, like autism, cerebral palsy, or Down syndrome. It could also be acquired, so someone who's had a stroke, who's had a traumatic brain injury, or who has a neurodegenerative disease like ALS. And it could also be temporary, so someone who's intubated, like in the ICU, in the hospital, they may need this just while they are intubated, and then when they're extubated, they wouldn't need the AAC anymore. So maybe you know someone, or many people, who have one of these conditions and who could benefit from AAC. Why use AAC? I always say, well, why not use AAC? But that's me. So there's so many reasons to use AAC, just in general to increase communication, but also to increase receptive language. So receptive language is what we understand, and often with an AAC system, there's symbol support on there, and and other people can use your AAC system and build up receptive language, or what they understand, and connect the words to the pictures. Obviously, well, not obviously, it can increase speech production, and that's because some AAC systems have voice output, and that provides a model for speech. So sometimes clients will imitate what their device is saying and increase their speech production. It can also kind of take the pressure off oral speech production, which can in turn kind of help it when you're not feeling so much pressure to talk with your mouth. It can also improve behavior, and you might wonder, well, how does that work? Well, behavior is communication. It just may not be the desired form of communication that we're wanting. So AAC gives people another way to get their needs met and say what they want or what they don't want. And then they don't have to use maybe negative behaviors to get those needs met. It obviously can increase participation in school and in the community. It can improve your literacy skills because AAC often has spelling and phonics pages or abilities. You can demonstrate your knowledge. How can you tell what you know, like especially in school or at work, unless you have a way to communicate it? And also, last but certainly not least, it can increase social closeness. Being able to say, I love you, or I need you, or let's cuddle up and watch a show. It definitely can increase that as well. So in the next slide here, I have a quick video of AAC in real life, just so you can kind of get an idea of what I'm talking about here. And this is very brief, but it's just a girl and she's rooting for her favorite team.
Go ahead. What do you want to say, Kaylee?
I like 49ers. I like 49ers.
Me too. Say go Niners.
So just, just something fun, that it doesn't always have to be for serious communication. It can just be for cheering on your favorite team. And you can kind of see what that looked like when she was using the device. So why does this matter to you? Well, I know we have a lot of different types of folks joining us on the call, but no matter what your role is, you may need to obtain information from somebody. So, you need to get that from them in one way or another, and AAC can help you do it. Maybe you're a medical provider or a first responder, and you need to be able to treat the right problem. Just in general, it's important for you to be here so you can promote effective and efficient communication and also respect communication differences and understand that people use different modalities in order to express themselves. So hopefully you're thinking about someone you know who used AAC, or maybe who could have used AAC, as we continue through the presentation today. And there may be many other reasons why this is important to you. Also, I am having the chat monitored, so if there's any questions or anything that you want addressed, I don't mind. You can interrupt me and we can address those. So. All right, so moving on to different types of AAC. Let's get into that. So there's many different types. They can be classified as no-tech, low-tech, and high-tech, and we'll go into some more specifics in the next slides on what that means. Also, people can refer to their communication systems by all different names. They might call it their talker, their device, their SGD, which could be, which stands for speech generating device. They might call it their words, or they may call it by the name brand, such as Owego or Dynavox. I work with a young man whose device is made by the Prentke-Romich Company, or PRC, and so he calls his device PERC, which, you know, using the PRC to kind of give it a name. So, okay, so no-tech AAC doesn't require a device. So it's gestures, facial expressions, and manual signs, things that we do with our body. That's no-tech, so pretty simple. And then we have low-tech or non-electronic, and that can include writing with like paper and pen, pictures, symbols, picture cards, communication boards and binders. Maybe you've seen some of these signs popping up in your local parks and playgrounds, these communication boards. I'm always really excited when I see those because it's just kind of giving increased access in those public spaces. But people also have their own personal communication books and binders. So in the next slide, we're going to watch a quick video of a son and a father using a low-tech system. It's called POD, which stands for Pragmatically Organized Dynamic Display. And you can see that there's no electronics, it's just paper-based. It's quite robust, it's a very thick binder. And as he selects things, it kind of tells the dad which page to turn to. So, so let's go ahead and watch a little bit of this video to see low-tech AAC in action.
More to say. I want to play. You want to play? Sensory play. You want your swing. I can pull it down for you. You want to play with your swing? Do you have something else to say? Turn the page. Goodbye. Are you done?
So we'll stop it there. But you can see he's also using some no-tech AAC. You saw some gestures that he was using too, and also the all done sign there. So that was a combination of both low-tech and no-tech in that video. So then we have high-tech AAC. So this is often called an SGD or speech generating device. It's usually seen as a tablet or a computer, but sometimes they're dedicated devices where the software is only for communication purposes, and then other times we have a non-dedicated device, so that would be like an app on an iPad. And high-tech devices, there are lots of different companies, and they use different layouts and a variety of vocabulary page sets. So there can be different types of symbols, Some of them just have words only, some of them use photos. They can be organized differently, like how they're categorized. And some of them might have 8 buttons and others could have 108 buttons or even more. So there's a big variety in what you see with what the companies are putting out there and for high-tech devices. So the next slide has a video of an adult using AAC. Now what's interesting, he has aphasia. So the first part of the video, you'll hear someone asking him questions and he's having a little bit of difficulty answering those questions. And then you'll see that he has his AAC device after that. Now what's unique about this video is that this gentleman actually has like an earpiece in, and so what his device, the voice output on his device is actually just so he can hear it. But once he hears his device, he can then repeat what it says. So like I said in an earlier slide about increasing speech production, you'll kind of see that here and how the device really makes an impact in how he's able to answer these questions. So let's take a look at this.
So I'm going to ask you some questions about yourself that I want you to try and answer.
Yes, okay.
Okay. What's your name?
Name is, okay. Name is, decimo. Name, okay,
Where do you live?
okay. Williamsburg, Virginia.
And how old are you?
Not the same.
Now I'm going to ask you the same questions, but you have your touch talk in front of you to help you if you need help with them.
Okay.
Okay. So let's start with your name. What's your name?
My name is Bob.
Okay. And how old are you, Bob?
61 years ago.
Okay. And where do you live?
I live in Williamsburg, Virginia.
Okay, so you could kind of see how that worked for him with his earpiece and the auditory feedback. He was then able to repeat what the device was saying to him, to his communication partner. So there's also lots of different access methods for AAC. So you could use direct access, like with your finger touching the device, or maybe even using a stylus to press the symbols. There's also something called scanning, where you use a switch to select a message on the screen. It's a little bit hard to describe, so I do have a video that illustrates that, that access method a little bit better. Eye gaze, so selecting your message by reading eye gaze movement. Either a partner can look at what you're gazing at, or a device now has ways to, I can't explain the technology, but it does have ways to look at your eyes and tell where they're looking and make those selections on your screen. And then also head pointing, where basically your head becomes the mouse for the communication system. So in this next video, we will see a little girl and she is using two-switch scanning. Now first I will say she is not in an ideal like seating position here, but I do think you can see how she uses one switch to move through her options and the other switch to make her selection. So I think that is clearly illustrated here, even though if we have any OTs or PTs in the audience, they will note her seating is not ideal here.
All right, we're all done swinging. Let's see what our
what are we gonna
choices
do?
are, honey.
Car wash,
Think about it.
water speakers, swing,
I want to swing.
You want to swing.
job.
Good job.
So she was using one of her switches to move that, and she could hear the choices as well. And then when it got to the choice that she wanted, she used her other switch to indicate that that was her choice. So that's kind of what switch scanning can look like. So now I'm going to transition into communication partner training and talk a little bit about how you can be a good partner for people who use AAC. So first off, what I'm going to talk about kind of falls into these 4 categories, and so we'll go through each of them individually here. So first of all, presume potential. So treat people as you would anyone else. Presume that they can communicate with you just like anyone else. And remember that everyone has something to say, and also make sure that they have access to their AAC system. You can't have a two-way conversation if the person doesn't have access to their AAC. So it may be in a backpack or in another part of on the table or desk or something like that. So just make sure that they have access to that. And then you need to be persistent. So don't give up. Sometimes it is going to be a little different than talking with someone else, but don't walk away too quickly. Realize that you might have to be flexible and ready to adapt. For example, you might have to change positions. You might have to move closer to them, or you might have to look on their AAC system and on their speech display for confirmation of the message that they just spoke. So just be ready to adapt. Also, use eye contact and expectant looks so that the person who uses AAC knows that you're waiting for a response from them and that you are listening. We also have a tendency to ask a lot of questions all at once. Oh, where are you from? How old are you? Is this your first time here? You can just sort of bombard someone with questions. And it takes a little longer to use AAC. So you do want to ask just one question at a time. And then you also have to think about the type of question that you're asking. So an open-ended question would be, what hurts? And so then it could be anything. So that's open-ended. A closed-ended question would sort of be like, does your chest hurt or your stomach hurt? So you're kind of giving, there's only maybe 2 answers there, so it's closed-ended. And then a yes-no question would be, does your chest hurt? So there's really, there's only a yes or no answer. And when you're asking your questions, you want to pause 10 to 20 seconds before asking again, because again, sometimes using AAC can take longer. So you don't want to jump too quickly to the next question or repeat yourself if the person is actively trying to answer. And then also after they answer, let them know what you heard. Maybe their message was a little bit telegraphic, or maybe you only understood one part of it. So do stop and tell them what you heard, repeat it back to them. So if there's a communication breakdown, they can work to repair that. So in addition to being persistent and patient, you should also be patient. So provide wait time, remain expectant, and don't jump in if they haven't responded immediately. Again, don't try to finish their sentences or guess what they're trying to say unless they've indicated they'd like you to do so. Because it can just take a little bit longer for them to get their message across. Also, don't touch their device or their mobility equipment without permission. So that's sort of an extension of their body, and so really is kind of impolite if you don't know them to be touching any of the equipment that goes along with their person. Sometimes people who use AAC, you need to know a little bit more about how they communicate. So, and also people have varying levels of proficiency with their AAC systems. Some may be really familiar, they can navigate their systems independently, they're very proficient users, but for other folks, it can be more difficult, it might take longer because their system is new to them or they're still learning. So you could also ask if there's someone, you know, nearby who might help you communicate with them. You could ask if they have a communication board or a speech generating device if you don't see one present. So you could ask if they have one and if they have it with them. If someone doesn't have an AAC system with them, but it doesn't seem like they can communicate with you orally through oral speech, you could establish a yes-no system with them. So again, I know you are coming from all different disciplines and different backgrounds. So we talk about this with first responders, you know, and kind of an emergency scene, but this could also be helpful in the community or, you know, with a new client or someone that you're meeting for the first time. So you ask them, show me how you say yes, and you pause, and then you ask, show me how you say no, and pause. And so for some folks, it could be, you know, a head shake and a head nod. It could be, I blink my eyes once to say yes and twice to say no. Maybe they look off to the right to say yes, they look off to the left to say no. Maybe they do something with their hand, they shake their hand. So you're just finding out what's their method for saying yes and no. And then repeat that action back to them to confirm that you've understood that that is indeed the way they say yes and no. And then you can also follow up with, how would you tell me I don't know, or that you want to say something else? And so maybe that's a shrug of their shoulders or you know, a shake of the hand. It's really independent or individual to that person. But once you get these clear signals established, then you can ask yes/no questions and, you know, and get those responses back from them. Now, to add to that, so you can just ask yes/no questions, but you also may have access to a low-tech communication board. And so if you've established a yes/no and have a communication board, you can do something called partner-assisted scanning. So again, once you've established that that AAC users yes and no, and you have a communication board, you can slowly point at the rows or the columns on the board and ask the person, is what you want to say in this row or is in this column, and go through a communication board. And I have one on the next slide to show you. So you can go through the board and ask them if it's in this row or this column. If they say yes, then you go through each icon or word in that row or column until the communication partner indicates yes again, and that they've selected that word or phrase. And you repeat it back to them to confirm, and then you continue on. So, for example, here is a low-tech communication board. This is from a company, an Iowa-based company called Talk to Me Technologies. They have many free communication boards available for download on their website, talktometechnologies.com. You can go there and download any of these. They have quite a few boards for free. So this is just one of them. But for example, if I was presenting this board to someone and I wanted to do partner-assisted scanning, after I established their yes and no, I might start with that first purple column and say, is what you want to say in this column, and gesture to it. And then if they indicated yes, then I would say, who? And wait for a yes or no. What? where, when, and then they give me a yes, and oh, you want to know when we're going to leave, or something along those lines. So that's how you could do partner-assisted scanning if they were unable to point to this communication board themselves. However, if they are able to point, then they could just point to their messages on this board. So that's just one example of a communication board and how you could use partner-assisted scanning to help someone. And again, if they're able to indicate themselves by pointing or using a stylus, then they could do that, and that would be a lot faster. I wanted to show you a couple other sample boards. So this one is from Tobii Dynavox. They also have multiple communication boards that can be downloaded, but as you might notice, this one is in Spanish, and they have actually multiple languages available for free download. And if you have if you work with a population who speaks another language, hopefully they have the language that you're looking for, but Spanish is obviously very commonly used in the United States, and so this is an example of one of those boards. And then next I have a communication board from a company called Lingraphica, and they also have multiple free boards for download, but I do have a special connection to this particular board because I had a hand in creating it. So it is the Emergency Responder Communication Board, and because I collaborated and partnered with Lingraphica, I was able to inform some of the vocabulary on this board from the work that me and my graduate students have done educating first responders in the community. So there's one more side to this board, so I'll show you that, and then I'll tell you a little bit more about the project we've been doing and some of the outcomes. So this is the back side of that emergency responder board, having the alphabet, numbers, pain scale. You can see it's definitely more for medical situations. But the board, both sides are available for free download from Lingraphica. So a little bit more about how this came to be. So, and this is kind of connected to my app, Rescue Voice. So the big idea was born during this outreach project where we educate first responders about individuals with speech limitations. So many of the slides that you just saw, we used with during this presentation. And we were bringing these low-tech communication boards, not the Lingraphica ones. It wasn't quite as spiffy as that. But now we have the Lingraphica boards that we pass out. But we were bringing these communication boards that I made, and every time I got asked the same question after showing them the communication boards, is there an app for that? So this photo is me and some of my SLP graduate students who are participating in this outreach. And so when everyone kept asking, is there an app for that, I decided to make one. So the app is called Rescue Voice, and I created it with help from resources here at the University of Iowa, as well as I did some community fundraising, and I applied for some mini grants to make this come to life. So at the top, you can see we have a website for it, rescuevoice.uiowa.edu. We've also created a link tree, which gives you access to all of our social media pages. We're on Facebook and Instagram, and there's also articles and other resources available on the Linktree site. So Rescue Voice, I designed it for first responders, kind of in place of not in place, but maybe in connection with the communication boards. So to help people who are unable to speak either because of a pre-existing condition or because of a current medical emergency. So it is a purpose-built app. I built it specifically for these situations. And it really is ideal for first responders and medical personnel, but we have found that other people do find it beneficial, and even just some families for personal use. It has tap-to-talk icons and text-to-speech capabilities. on it. This is one example page here on this slide where you can touch the body and it has voice output, so it will say whatever body part you've touched. We also have pain scales and type of pain, but you can see that there's tabs at the bottom which you can navigate to other types of pages. There's also instructions on each page, pre-stored vocabulary related to symptoms, pain, body parts, allergies, medications, different people, time, concepts, as well as places. And again, this is for people who have limited speech or maybe are currently experiencing like a stroke or a broken jaw, or for some reason they're not able to communicate with the people on the scene. So I did try to make it to be very easy to use. You just open up the app and it's ready to go with very little training. The vocabulary that I used was informed by first responders. Before we had the app and we were using communication boards, every time we presented, we said, what vocabulary would be beneficial to you? And so we kept kind of modifying the boards to based on this feedback. And then when we made the app, we could put a lot more of that vocabulary within it, because on a board, you're kind of limited to that 8.5 by 11 size. And this also allows patients to be heard by their providers because it has voice output. It's currently available only for tablets. I do want to have a phone version eventually, but I need to keep working on that and fundraising for it. It's available on the Apple App Store as well as the Google Play Store. It's currently $9.99 per license, but that money does go back into making app updates and improvements.